So now I'm in conversation with Mary Akangbe, and I'm delighted to have her as a panelist on this virtual conference. And I'm giving her an opportunity to tell us a little bit about herself and also the work that she does, where she's based, and how things are going with COVID-19. So Mary, tell me about yourself. Where did you start getting involved in medicine and healthcare?
Okay, so my background is nursing. So I trained as a nurse in Nigeria. And when I came to the UK, I went into theater and anesthetics and then trained as a specialist in minimally invasive surgery. That progression took me to health technology with robotics and genomics and then virtual education, which I think, incidentally is now very useful in times like this. And about 5 years ago, I founded Zenith Global Health, which is a platform for education, collaboration, and celebration. So what we do, we work with other healthcare professionals to showcase best practices, and also in the celebration aspect of it, it's an award ceremony where people come together globally to, share their experiences and things like that.
That's wonderful. Well, I'm hoping that we'll be able to recruit you into the International Society for Digital Medicine, which is what I'm involved in, with very much the same kind of mission and agenda. And as you say, it's very, very relevant today. Now, I'm sure you'll be too modest for me to mention it, but I understand you've got quite an armload of awards for various things and recognition for your work. So just tell me about some of the awards that you've got.
Okay, so was named as one of the 70 female health innovators during the NHS 70. And also I've got some innovation awards, as in on charitable grants. I've got, as an author, I have awards on, I'm a rising star. That was like a few years back, and that has helped me to build on what I'm doing as well. Mm-hmm. And also I do a lot of work, which, have put me in the forefront of transforming healthcare in Africa as well. So that's just some of the things I've been acknowledged for.
Okay, well, I'm delighted that your work has been recognized. Before we get on talking about COVID-19 and how things are where you're working at the moment, just a reflection and observation really that technologies have made an enormous impact on the role of nurses. And what's your opinion on that? Are you seeing nurses being able to take a lot more responsibility for by being empowered by the technologies?
Yes, I see quite a bit of that. I work with a lot of nurses in this field, like coming up with things to empower the patient, enable care. But I like to see much more actually, because I think because the learning curve is really curve. A lot of people shy away from it at the beginning. And those of us who stuck with it a few years back are able to build on it, be recognized, be spotted for these skills. So what we need to do now is to bring more nurses on board and reassure them, because the learning curve is shorter than it used to be. Like in a keyhole surgery, for instance, when we first started, some of the procedures that were taking us 10 hours now take us 3 hours. If we use the robot, it's even shorter. If we are a research nurse, the process was really long. Now we have research aspects into genomics and other areas like that. So yes, nurses are doing a lot, but personally, I'll see us to do a lot more. And I took this up with the CEO NHS England the other time we met.
Yeah. Okay, talking about keyhole surgery and the use of robotics to support keyhole surgery, are you actually involved in the surgical process yourself then, as in your role?
Yes, that's part of that is my specialist area before health technology. So I trained as advanced nurse practitioner, So I can operate in the role of a senior surgeon with the help, with the presence of a consultant. So I can put second report, I can hold a camera, I can manipulate, and as an anesthetic nurse as well. So I'm actually always like part of the team in innovation in any aspect. Like when we did the first intra-op fetus, we operate on the fetus in the uterus and carried, the mother was able to carry it to term. I was part of the planning group and things like that with the people that were doing it ahead of time that came to us. I sourced the instrument equipment and got everything ready for the day, was there throughout. And I mean, we've done quite a few since then. And so in doing that, I trained my colleagues as well, so that, it becomes a process, continuous process.
Well, that's wonderful. It's marvelous that we're able to do so many more things to save many more lives today. But coming on to COVID-19, what's happening in your part of the world at the moment? You're at King's College, I understand. Is that right?
Yes, yes, yes.
So
Yeah.
what's happening
So
in your part of the world?
Yeah, so I work at King's College. Presently, I'm not in the clinical area, but I'm in close contact with my colleagues. And what the hospital is doing is to make as many beds as possible accessible to these patients when they come. So like the recovery area, like some of the other regular ITU, HDU, they've been converted to COVID-19 HDU, ITU, so that there's enough. And nurses are being redeployed as well. I was having a chat with somebody the other day, and somebody like me, when it's time for me to join that team looking after the patient, I probably find myself in the critical care area because of my, skills and experience. So that's what they are doing at the moment, and just in the surgical area, working on cancer patients and emergencies. Everybody else has been redeployed to other areas to help.
Yes, and I watch every day the government briefing, Matt Hancock, and he was saying the other day that you still have in the UK sufficient capacity in the intensive care facilities for COVID-19. Is that your experience in London?
Um, well, I wouldn't say sufficient in that sense. I'll say there is enough, especially because of what I said earlier, because people are being redeployed. So the fact that we have these extra hands that can focus on treating the patient makes a difference. But we still need more. That's the
Yes.
truth of it. There can never be enough, because you have to take into consideration people will fall ill during that time. People will have their annual leave or days off, and we're talking long hours now. So a lot of the departments are working 8 to 8. And that is one of the strategies to make sure you have more nurses for longer time rather than 7 to 3 or whatever. And at the same time, healthcare professionals have time to be away from the hospital as well. So if you do 3 long days, you may have 2 days off or whatever, where possible, because again, it will depend on the what is needed, in relation to what's going on, the services that needs to be delivered.
Well, I have to say that I'm sure all of us in the UK are so grateful for the care profession and nurses and the work that you do in very demanding circumstances. We couldn't do without you. And if it's any comfort to you, on every Thursday at 8 o'clock, myself and my partner go onto the driveway and we give a round of applause for you.
I know, I tell you, that is so humbling, because I live in a cul-de-sac, and the first time my neighbors came out, everybody did their clap, I was clapping as well. And at the end, they turned towards my door and they were clapping, thanking us nurses and my colleagues for what we're doing, healthcare professionals in general. And, that was a moment when you think of the hardship and the stress and the strain and everything, it makes you think it's worth it. Because for healthcare professionals, we're still going to see the backlash at the end, the psychological implications and things like that.
Yes,
So it makes a difference. The clapping makes a difference. Thank you all.
I know No, that's a pleasure, and the sooner this is situation is resolved and we get back to some kind of normality. But I hope
Yes,
people don't suffer from amnesia and forget all the hard work that's gone into it for the
yeah,
nursing profession.
exactly.
Yeah.
Yeah.
So thank you very much for taking the time to talk to me this afternoon, and I will look forward to seeing you again during the session. So I'm going to close the recording now and just say thank you very much, Mary.